Good evening and welcome. Tonight on the show, we'll speak with the coordinator of the Fiji Women's Crisis Center, Ma'am Shamima Ali. And in light of the COVID-19 pandemic, she'll be speaking with us remotely. That means she's not joining us in studio. All around the world, because of this pandemic, people are staying home. And that is causing some concern to human rights and women's rights advocates and activists all around the world. Because almost uniformly in all the countries, there's been a sharp increase in cases of domestic violence. And that's what we'd like to discuss tonight. We have with us Madam Shamima Ali. And first of all, Madam, we'd like to ask you, you spoke recently to FBC News about a sharp increase that the FWCC has recorded in the number of domestic violence cases. Let's talk about some statistics. Share with us some data, if you can, about how many cases you've received so far, how many of them were genuine cases.
We have the toll-free government line 1560 that we have been contracted to run, and our councillors are running that line. That is the toll-free line 1560. So from the 1st of April to the 17th of April, we have seen 316 calls received at the Fiji Women's Crisis Center on our lines, and about 454 calls on the 1560 line, which gives us a total of 770 just in 3 weeks of the month, which is very, very high indeed. Now, all these calls are not related to domestic violence, but 1/3 of them definitely are domestic violence cases. And we also have rape, attempted rape, we have child abuse, and there are also men who are calling up because there's also violence against men, and these are particularly young men who are staying at home, who've lost their jobs, and you know, the mothers and the families don't want people who are not working, so there's a lot of abuse. And other calls are COVID-related, people who don't have food, they've been laid off, and they don't know where to get their food and things from. So that's what we are looking at. Some people are scared about going to get tested, so we are referring them to the COVID line 158 and so on.
So you said 770 cases in 3 weeks. I mean, that seems like a relatively large number within a specific period. Is that cause for alarm? Are you worried about that?
We are very worried about that, because in a year we would get about around this much in a year, all the calls, the crisis center lines, So this is just 3 weeks, and to say that 1/3, just a little bit over than 1/3, has to do with gender-based violence, and most of that is domestic violence cases. So of course that is cause for alarm, and we are just beginning the curfews, the lockdowns, the social isolation, and there are huge challenges ahead if we don't address it now.
Ma'am, I understand that most of these calls, of course all of these calls do have to be confidential, and you cannot give out any details about specifics. But let's just break that down. You had mentioned that out of the 770 calls, 1/3 of them happen to be related to domestic abuse and also child abuse, rape and heinous crimes of that particular nature. Let's look at what sort of calls you're receiving. How is your center able to cope with having to reach out to those who happen to need help, especially when you happen to have curfews and you've got lockdown and you cannot physically go there and help out your clients?
Yes. Well, I can generally tell you the kind of cases without giving specifics of people and places, but there definitely is an increase in the violence experienced by women. Where there was already violence, the perpetrators were already there, women were suffering. The violence is now intensifying because a lot of these perpetrators are in the home now. There's also emotional violence. There is also a lot of coercive control, which are all parts of domestic violence. And now women who could have gone out and access services in the daytime, they're not able to because he's home. And they're not even calling on the phone. We get sort of veiled requests for food and things. So it's for the counselors, their experience, where they can notice domestic violence and realize this is a domestic violence case, and I just, we have to ask the right questions, and she can only answer yes or no. So we're having a lot of that. We're also seeing men using their wives, this kind of men, not all men, who are using their wives and children to go and do errands and pick up things from town while they're keeping themselves safe in the house. There are a lot of issues around grog drinking and things like that, how the money is being spent. There are lots of drivers right now in terms of everyone is feeling the trauma. There are some mental health issues where people have lost their jobs. They don't know where the next meal is coming from. So people look at the woman because usually she is the one who does the household chores, the caregiving, and it's her responsibility to be bringing in the food, putting food on the table and so on, and to make the budget last that is allocated for that. So a lot of tensions around that and a lot of frustrations that men would be feeling often, and particularly men of this nature who already have that, the nature of perpetrating, blaming the women, blaming the children. Then when we look at the children, they are getting the brunt of it. We are getting calls from, women-headed households where they have lost their jobs. A lot of women are in lower paid jobs. They are the first to go. And sometimes they work as a lot of times as domestic workers and so on, where there is no security. So they are feeling it. And so they're taking out on the children, as well as the men are taking it out on the children, where the father is also present. So, it's not at all an environment, while social isolation, keeping away from people is good for us to avoid the virus for everyone. For many people, it is also an added hell is where they are with the perpetrators. Then we have the women and children with disabilities. So there's that double jeopardy for them also. Then we also have calls from the LGBT community. The discrimination is greater because everyone is for themselves. They're in the house, they have lost their jobs, families don't want them. So, not a good place to be at all.
Main factor is the COVID-19 pandemic and the way that people are staying home. I was recently reading a report, or rather an interview, that the Samoan Women's Crisis Center did with an overseas media company, where she pointed out something that happens in a lot of Pacific Island countries, which is men, especially in our communities, men usually tend to leave the house for grog or other socializing activities around 7 or 8 o'clock. And these men that would usually stay outside of the house are now staying in the house. So it's unfamiliar territory for a lot of people. And a lot of people that are not already in existing violent relationships are now starting to see, I guess, some things that they might not have seen before. Do you think that in the coming weeks, if the COVID-19 pandemic and the way that these restrictions are being implemented, do you think, or do you predict that there will be more cases, or a higher exponential increase in cases?
Definitely, we can predict that. And really one of the drivers is, if you look at patriarchal societies like our specific countries and everywhere else, and it's everywhere, as you said, Ziad, earlier on, other countries are reporting this also, that it's the men who go out a lot more. They have the freedom to socialize. They go and grog, they have their beers, they go and watch sports, and they have more freedoms around that. So it's a very unnatural state of affairs for a lot of these men to be at home and cooped up with women and children whom they haven't, those men who have paid attention to in the past or thought about their welfare and things like that. So it's quite hard. And if we don't have our support services and things at the ready and don't live up to the claims we are making of what we can do, we predict a very sad situation, because this does give rise to mental health issues, We had, last year alone, we had 8 murders of women in domestic violence situation. So there is a tendency for that. We already are also getting, calls, suicidal kind of calls also. So it doesn't look good.
Ma'am, if I could just for a second go back to some of the factors that you had discussed. One thing that has slipped under the radar recently is financial dependence or financial independence. For whatever reason, some people have been laid off from work, or some people have had to be, forced to stay at home, maybe because of lockdown, maybe because of curfew, or maybe just because they're not counted as essential workers. With that in mind, since there is a change in the dynamics of finances that are coming into the household, how has that affected the women who, or maybe even men, whoever is calling in to seek the FWCC's help?
Oh, very greatly. That is why this is a toll-free line, and they are calling on those lines. And they are desperate. They are very, very desperate, these people who are calling. We are able to assist in some cases, particularly our women that we have already been working with. We're networking with other organizations like Friend and so on, who have got access to areas and are still doing delivery. So we're working with them, providing them with resources to be able to do that. But how long can one continue doing that? So, it's again, once again, either the woman has lost her job, other members in extended families, other members who have, and also, depends on where in the family's hierarchy different people are at. So the lower down you are, the more discrimination, the more violence, the more emotional violence, and things like that, yeah.
So I'd like to ask, because of the COVID-19 pandemic, every corporate entity, public sector, the private sector, we've all changed how we're working. You mentioned earlier about some of the changes that have happened internally at the FWCC. I've got 2 questions in relation to this. My first one is, what changes have you made? You mentioned that you're now working from home. Does that make it difficult or make it more challenging to address some of these issues that are coming to you?
Yes, of course, definitely more difficult, particularly for counselor advocates, very difficult. But we had started getting ready for this in January, at the end of January. We were looking at the global news, what was happening, and we knew immediately when that social isolation one was the major factors in prevention of the spread of the disease. So, we had already started planning what we were going to do. We had stopped all travel, our workshops that had been planned, we started canceling them and so on. And we started planning how we were going to work. So luckily we had the funds, because both Australia and New Zealand fund us. The 1560 line is funded by the Fiji government. So we had the funds to continue working, but not from the office. It is difficult because our counselors are used to face-to-face. It's a very personal, intimate relationship between a counselor and a survivor who comes to us. Then the accompaniment, the advocacy that we do on a personal level with the police station, going down there, to the health service, to all other services, to the courthouse, and so on. So that we are finding quite challenging, but we are finding ways around that. And so we have 25 lines going. Yeah, we have got 3 lines that are attended by the 1560 counselors, and then the rest of them, the 22 lines, are by all our counselors all over Lambasa, Rakiraki, Mba, Nandi, and Suva. So, and these lines are advertised, in the media, on Facebook and everywhere, by word of mouth. So we are trying to cope, but I just wanted to say at this point in time, there is a group, the GBV COVID group, that is part of the protection cluster, and this is actually led by the Minister for Women. And this group is made up of the NGOs, the service providers, the government entities, ministers, different ministries, health, police, Ministry for Women, the legal services, and the NGOs like Empower Pacific, Medical Services Pacific, Salvation Army, which is providing shelters for these women, as well as the Fiji Women's Crisis Center. So we are meeting, there's a core group that is meeting every week, and so, you know, we are working on a referral pathway. We've got that ready through the service delivery protocol that was launched last year. So the referral has to go well, and it is beginning to show results. That how do we refer, and particularly the police are so important in this work, and how we work with them. So that is one way that we have decided to work. The staff ourselves, we have Zoom meetings, and we try to meet 4, 5, 6 at a time, once a week at our offices, keeping all the rules and regulations in place. But the face-to-face is the one we find very challenging, going out. And also, you know, women will come out during the curfew period. When he is asleep, she can't come out in the daytime. So we're also negotiating with the police who are in this group with us, in the GBV group with us, as to make police officers aware. Please do not arrest them, ask them if they are domestic violence escapees, then please refer them to 1560 or deal with them as a domestic violence survivor rather than someone breaking curfew.
The FWCC also does work where a particular person may need immediate extraction, or they may immediately need to leave the household. So if that happens to be in a lockdown area, so suppose Suva has been locked down and this person needs to escape to go somewhere else, perhaps to another family member's house, and that needs to happen immediately. So for someone listening who may need this sort of information, what are the avenues that they can pursue?
Yes, if you have a police post nearby or a checkpoint nearby, I would say run as fast as you can, but keep yourself safe. But call 1560. That's a toll-free line. If you can call that, the command center's numbers we are giving to everyone, call those numbers. I've been assured by the Commissioner of Police that the police are aware of this. So that's one way of doing it. If you call 1560, we have found that the police will go immediately. They have gone in the Suva area. We are having problems with other police stations, but definitely we haven't had problems around the Suva area where they have gone immediately wherever we have directed them to go, and so on. So, you know, so that's one thing that that is happening. We also part of essential services when there are lockdowns, and these names and numbers have been submitted to the police through the GBV group, through the Ministry for Women, and so we have got 4 drivers on call, and we have got at least 2 counselors in other parts of Fiji, and we also have got 6 counselors on call in Suva who will go out if the need arises.
Ma'am, let's look at something that a lot of people tend to forget about. We do, of course, advocate for anyone that happens to be a victim of domestic violence to seek out help. But then you also happen to have children who do not know where to go or who to talk to, how to pick up the phone, and, you know, what's the proper etiquette or what's the protocol, who to ask help for. With the school holidays being extended for such a long time, can you give us any stats or any numbers on the number of children who have come forward asking for help?
Yes, so far we have had about 6 child sexual abuse and 2 physical, emotional, verbal abuse. And counting the one on 1560, we've had about 12 cases so far. There is another toll-free line, 1325, again a government line, and Medical Services Pacific is running that line. So we would say children can call that line also specifically. We have had, what is the good thing is that neighbors are calling us when they are seeing children in strife, if children are getting beaten up, sworn at. So the bystander idea is working to some extent. So, so they are, the neighbors are calling us, then we call the police, the social welfare, and then they take over from there. And I would really advise children to tell someone about it. Tell a neighbor very quickly who can get help. If they're talking to people, tell a friend who can then tell, or if they can get to a phone, to call 1325, and if that doesn't work, 1560.
Ma'am, with that in mind, children being away from schools, being away from their friends and also from teachers, a certain confidants that they would talk to, that they would be comfortable telling their secrets to, or at least opening up and asking for help, that would come down quite significantly. And with all this in place, I can understand for them to reach out to someone during these times, someone who is new, it would be difficult. Also, we've got the Minister for Education asking for parents to be more vigilant in making sure that the safety and welfare of children is prioritized, especially with the school materials now being disseminated for them to study from home. With that in mind, is that also a concern for the FWCC?
Yes, of course, because, if you look at perpetrators of violence against children, as with women, whether it's sexual, emotional, and physical, it's often in the home, and it's often by people known to the child, close to the child, in a place of trust. So definitely, it's a difficult situation. I would say that the Ministry for Education also has a responsibility in passing this message as much as possible during the school programs on radio, advertising 1325, 1560, the lines that they can call, and so on. Of course, it's difficult for women, it's difficult for children more, because they are a lot more vulnerable.
Moving on, you said earlier that you're also liaising a lot with the Fiji police force. If you could just expound on I guess what areas you're talking to them about, and how the police force collectively can assist in better catering to vulnerable persons at this time.
Yes, definitely. I think I'm quite fortunate that I have worked with the Commissioner of Police, and before Mr. Ngilio, and now with him, and have that line to him. I can WhatsApp him, I can text him, and he will respond to me. So I have that direct line, but also because of all the training we have done, the Crisis Center has got a relationship with the police. Whatever it may be, we're also the strongest critics of the police force, but we also give a lot of support as they support us. So, so right from the beginning, I had already raised this with the Minister for Women, who had raised it with the Prime Minister. And if you remember, the Prime Minister, in one of his addresses to the nation, mentioned that, which was a great thing. The Commissioner of Police has also mentioned that. And what we also would like is all the police officers to be able to do this. We have a training package that has been prepared with the help of UN Women in the GBV group, a COVID group, and that we're hoping to roll out very soon with trainers from UN Women and trainers from the Fiji Women's Crisis Center doing virtual training for frontliners, both in the health services, education, in the police services. So, these are the plans, and because of the relationship and because the police force already has their programs, they have got the no drop policy, the sexual offences unit, they have got GBV officers now, that it'll be easier to work through. But everything is not going to be perfect, we realize that. So one of the roles we have is monitoring and documenting where it's not working, and where it's not working, we know the divisional commanders, we let them know, and if we don't get any recourse, then the Commissioner of Police is there, that I will send him heavily documented and with a lot of data, texts and emails and so on.
one thing that a lot of perpetrators may be taking advantage of is the fact that they're able to keep their victims within their four walls and trying to prevent them from seeking medical help, not just for fever clinics or for COVID screening, but also for essential help that they need. You may have those who have afflictions like diabetes, or may need to go for dialysis or for checkups, or even to go to the OB-GYNs. And with all of that in mind, how is the Fiji Women's Crisis Center trying to work with the Ministry of Health to look at these issues?
Look, definitely, and in the calls that we have received, we have got there that women are who are with men like this, they are being prevented from attending their clinics. They are very worried about their health. They have got existing conditions. But there are also pregnant women who are getting assaulted and who need to get to clinics also. So these women are being prevented. So their health is actually on the back burner, and we are very concerned about that. The UNFPA is working in the health area, and they're working with health personnel in training and so on. We, through the GBV, the COVID GBV group, we are also, health is part of that group, so we're working through health to attend to women and to look out for these things also.
So for someone who is trying to make a report about being a victim of any sort of violence, whether it's verbal, emotional, or most likely physical abuse, to get assessed, to go to the doctors, are they able to access those services as they normally would? Would you be able to give an answer on that?
No, I'm not, because so far in these last 3 weeks or so, since we have been in social isolation, we haven't had a case of that nature. We have had police go out to where there's an actual domestic violence happening, and the woman has managed to call us, and we've called the police. The police have gone out and checked that out and assessed that. And in some of the cases, in the cases as far as I can remember, they have taken the perpetrator out. So from the cases that have, the women who have rung us, we haven't had so far a case where she's been severely injured. If she was severely injured, then definitely we'll work with the police, and we'll work with our drivers and our counselors to get out to her and get her to a hospital. And I'm hoping that that they will be seen to, and they will be a priority. I'm also texting the Minister for Health also, that ensuring that, and encouraging and ensuring that there is space there for women who are badly injured.
Ma'am, for those who happen to be victims of sexual assault, who are subjected to inhumane conditions, emotionally, mentally, and also most likely physically as well, for those that need to reach out but are unable to, they're not able to talk about it freely because they happen to have the perpetrator right there. And I don't mean to play the devil's advocate, but with that in mind, of course, it's a two-pronged attack, and also two-pronged way of dealing with this. You need to look at the victim and also the perpetrator. When they're within the same four walls, how do you go out and help in that situation?
Well, I would, if that did happen. We are having also reports of marital rape, increased marital rape, and we would go with the police. If the woman needed to be taken out, or the perpetrator, we would go. We would try to get her to a place of shelter to gain health services and so on. And we do have the Salvation Army that is at the moment providing shelter, and we're very grateful for that. But it is difficult. This is the challenge for us. If the survivor is able to get to us, we will do everything that we can, use our referral pathways, and we ourselves would go out there. But if she can't, then really it's very sad that she is suffering in that manner. And this is where other family members come in. This is where the communities come in. The people who are living around these families where this kind of thing is happening, where they can help out and do the referral immediately.
So while we're talking about community members and how they can assist, you mentioned earlier that a lot of or most of the cases of abuse are situations where the perpetrator was known to the victim. So in a situation where there's not an adequate support system, for members of the community, for example, neighbors, like you mentioned in an example before, what are the signs of abuse that people should usually look out for?
If they hear a lot of noise coming all the time, and if you've lived there for a long time, you would know there are things happening there that should not be happening. So when it's happening now, you do know. You might see that the woman or the girl have been managed to get out sometimes, and you might know they have sought help somewhere. But in this kind of time, they've got nowhere to go. And if you can get her alone somewhere, just by signaling or something, whether she needs help, whichever way you can do. Otherwise, I would say, either call the command centers or the police in your vicinity, or call 1560. And please don't be a bystander, because we are getting calls from people, which is very good, slowly trickling in, but that is a very good sign that we are taking community responsibility.
Was a particular city which had recorded a huge spike in divorces that were being recorded. And most of the reasons for the divorces that were being recorded was because of marital discord. There was financial problems. There was also emotional abuse. There were all of these factors that had not existed in previously so-called happy marriages. Do you see that becoming a trend that is becoming a concern for you in Fiji?
Oh yes, I was also watching the news, Australian news yesterday, and they're talking exactly about this, because the man often is so much out of the house. So, and then both of you are not meeting, and and you're not spending too much time together. But all of a sudden, it's 24/7. So then all the discord, you start noticing things, you start, things that are happening, then added onto that, the whole thing around the virus, the COVID-19, the no work, having to look for food, thinking of the future, the children are all around you. People start, you start noticing behavior that is not at all conducive to a good relationship. So all those things come to the fore. And if there was domestic violence, it's exacerbated and so on, there's more control. So of course, I think in Fiji also, either people will come very close, where if there is a man in the house, if there was more of an equal relationship, you can bring them closer, or if the man will realize just how much work the woman does when he's at home, and watching her do everything, the caregiving, all the household chores and so on, that might be a better appreciation. He might be helping around, she might, and for some people they might get closer, but definitely other countries, China and so on, are talking about divorce lawyers being very busy at this point in time.
Ma'am, tonight we've been able to get some very interesting insights from you. Thank you so much for joining us, and we understand that you're practicing social distancing very strictly. In spite of that, thank you so much for taking your time out to join us tonight.
Yes. Ziad, can I just say one thing?
Sure.
I just want to send a message out to men, and I want to say to them, while the COVID virus is something we are trying very hard to control, and it's very difficult for us to control this, the violence against women is something that's in your hands, in the hands of men. The perpetrators, please take this time out. This is when we're supposed to be kind to each other. The Pacific Fijian culture, compassion, love, helping each other. Please remember, our health services, our police are overburdened, and if we start getting, our hospitals getting full, people are just preparing for, any kind of a crisis. Let's help them out too, and let's just be kind to each other. Men, and I would say to them, just be kind And if you are doing these things, please stop it and see what you can do best, because we are stuck in this. We don't know for how long.
Great. Thank you so much for joining us tonight, ma'am. We hope to have you again.
Thank you very much.
And that's all we have for you on the show tonight. Remember these two toll-free numbers, 1560 and 1325 for children. Thank you for joining us tonight. Stay safe.